Hi, my name is Tara, and I am doing a multi-systems family therapy approach. So basically, this approach is a problem-solving approach for families that have multiple problems and they need to prioritize which ones they need to focus on first. This allows the clinician to maximize the effectiveness that they're going to have in each interaction that they have with the families. And it also means that the family is going to be able to take an active role in the decision-making process of what's going to be the most effective in their treatment. They enlist all the members of the systems, like as many as they can. It's called marshaling the troops, which is a very interesting thought. They use an integrative model, so it's a structural family model, it's an ecological application model, and an eco-structural model. So basically that means that it's going to be an active and present organizational structure. So the therapist is joining with the family to promote leadership and skills, and it creates an ongoing interaction with the person and their environment, so like the community. And it also gives like a social structure connection, so that means it's options and power, so it gives the clients control over their lives. It means that they're not powerless, and also it gives them purpose and meaning in their life. The goals of this is to help the families that are overwhelmed meet the needs of all of the members, and the counselor is able to enhance the resources that are available, so they give them as many resources as possible to be able to allow them to be the most effective. And it's also a strengths-based and action-oriented model, so they're focusing on all of the client's strengths and their resiliency. So this means that they're going to address the risk factors and support all of the protective factors. So these are like coping, problem solving, organization, leadership, affection, empathy, and the counselor is really an advocate and an encourager, and it's like a strengths perspective. And the 4 goals of treatment are to join, assess, problem solve, and restructuring the family. So a lot of the families need to have better organizational and restructuring to be the most positive. And really the social worker is the social worker and the family relationship is the most critical in this approach. The social worker is able to do this through modeling and coaching. They use meaningful vocabulary. They are appreciative of the environment when they go to the houses. They show strength and affirming attitudes. They build bridges, and they reach out to the extended family to recruit them for counseling. The chapter specifically talked about reaching out to the men in the families, because a lot of times those are the people that kind of have a little bit more of a pushback. So if the therapist is able to get the males in the family on board, then it tends to enhance the counseling sessions. So it also is empowering rather than just helping. So the home visits or the counseling oftentimes is home-based counseling. And the 7 sections of the multi-systems approach is individual, discussion of change, family subsystems, so that's like strengthening leadership, the family household, which is solution focused, extended family, non-blood kin and friends, church, and social services. And really they focused on family preservation, so it's the fact that children should remain with the family if possible. And again, that therapist is the role model, and providing empathy and person-centered, collaborative, practical solutions, which promotes the resiliency of the families. And that is something that they really just emphasized in this approach.